Okay, so here we're going to talk about respiratory tract infections. And first, we have to talk a little bit about the structure of your actual respiratory tract first. So, as an overview, we typically think of the respiratory tract as having an upper and a lower. The upper respiratory tract is going to be colonized by microbes or normal flora microbes, whereas your lower respiratory tract is going to be considered sterile. So, nothing should be growing in your lower respiratory tract. Your upper respiratory tract is going to continuously be exposed to the external environment. You have your nasal cavity, sinuses, pharynx, and larynx. The infections of the upper respiratory tract are typically going to be more of an irritation, and they're going to be very common, the common cold, for example. Whereas in the lower respiratory tract, that is where you have your lungs and your bronchi, and the infections here are going to be more dangerous and interfere with gas exchange, oxygen and carbon dioxide. And so pathogens are going to be very contagious if they can infect your respiratory tract. They're going to be easily transmitted from person to person with few exceptions. Now, these are typically going to be communicable diseases, and some of our more famous infections are respiratory tract infections, such as influenza, and now, of course, SARS-CoV-2. So we have in our upper respiratory tract, you have infections that can lead to ear infections, otitis media. We have our common colds, our parainfluenza viruses, which most children are exposed to during the first years of life. We have diphtheria and strep throat as our bacteria infections. And there are other diseases of the lower respiratory tract. Again, some are going to be pretty famous, like anthrax. We have our pneumococcal pneumonia. We have our Q fever, and Q fever is going to come from our farm animals, especially. So goats, sheep, those type of things have Q fever, and they can transmit it. Legionnaire's disease was famous in 1976 in a hotel in which many of the participants in a Legionnaire meeting came down with a severe pneumonia. Many of them died. Also famous tuberculosis and Mycobacterium tuberculosis does infect the lower respiratory tract. Pertussis is interesting because pertussis will infect the upper respiratory tract, but it has effects on the lower respiratory tract. And so pertussis is going to be a cause for whooping cough, but it also has a toxin which is going to cause a swelling almost of your airways. And then we have our severe acute respiratory syndrome, or SARS, which now, of course, we have SARS-2. And influenza is another, of course. We also have some of our fungal agents that can infect the lower respiratory tract, histoplasmosis and blastomycosis. For children, RSV is very important, but adults also get infected with RSV, and they're usually the transmitters to children. Now, we also have cysticosis. Cysticosis is going to be from parrots or other birds, so people who have parrots as pets can come down with a pneumonia caused by cysticosis. All right, so for example, we have many different ways to protect ourselves. So in a normal, healthy person, you will have ciliated cells. Oftentimes, your viruses are going to come in and disturb those ciliated cells. Pertussis also, Bordetella pertussis, the bacterium that causes pertussis, can also infect the ciliated cells. And they basically wipe out the ciliated cells, and that makes it so that you cannot get rid of mucus. You have trouble getting rid, you have a very dry cough. And also bacteria from the upper airways can get down into the lower airways and cause diseases such as pneumonia. There's also going to be macrophages, so our immune system is going to be part of the host defense system, and you can have obstruction that will lead to bronchus and infections due to an obstruction such as a bronchial carcinoma. They also, just the action of your muscle cells, of pushing things out, your ciliated cells, pushing out mucus, all of those are going to be very important in keeping your airways clear. And so any sort of trauma can also affect the ability of your muscles to allow you to cough, to dispel anything that is actually in your respiratory tract. Now, fungi are usually not thought of, but fungi are very important, especially in a nosocomial environment. And the CDC has published that 15% of ICU SARS-CoV-2 patients have aspergillosis. And so this is a hospital-acquired respiratory infection. So our fungal infections are going to be very important, and they typically are always going to start out in the lungs, and the most dangerous are going to be Aspergillus and Pneumocystis jirovecii. Jirovecii is a yeast-shaped fungus, does not have a fungal form. Aspergillus is a fungus, it does not have a yeast form. So Aspergillus with its naked conidia or spores shown here is what it will grow inside your lungs looking like. And then Pneumocystis jirovecii will grow like a yeast cell. Let's just spend a little bit of time talking about, in general, the bacteria that cause common respiratory system infections. And you can see that we have ear infections, sinusitis, upper respiratory tract infections are going to be caused by our normal flora bacteria. So we have strep pneumoniae, group A strep or strep pyogenes, and Staph aureus. Some ways to tell the difference between a pneumoniae and a strep A is the strep A gives you that typical chain of bacteria that we're used to for streptococcus, whereas streptococcus pneumonia never forms a long chain. It's always going to be a diplococcus. Staph aureus is always going to form a great blight cluster, and then we also have Haemophilus influenza. There is a vaccine available for Haemophilus, and therefore Haemophilus influenza is not a big cause of respiratory infections anymore in places like the United States. Now, again, one thing to keep in mind about your bacteria infections, they often are going to follow a virus infection. So your sinuses and eustachian tubes are going to have those ciliated cells that viruses such as parainfluenza virus or respiratory syncytial virus will wipe out, and that will allow your bacteria to move in and colonize. You have your mastoiditis, and that's going to be a very uncommon site of infection, but once it is, it can be very serious because of the ability of the bacteria to move into the nervous system or into the blood system and disseminate. Now we have our group A, group C, and our Corynebacterium diphtheria as our gram-positive bacteriums that can cause upper respiratory system infections. We also have in this lump some gram-negatives, or Mycoplasma pneumoniae is one of the more common causes of pneumonia, walking pneumonia. And they can also cause upper respiratory tract infections. Pharyngitis is pretty well known, strep throat, so it's often caused by strep pyogenes. Strep pyogenes has a mechanism for binding to our epithelial cells, and you can see the pus forming. And remember, pus is our dead and dying immune cells, bacteria, dead and dying epithelial cells, etc. So you're going to have toxins that are going to be produced by strep, and it can also lead to abscesses on the tonsils. Disseminated strep, or strep that gets very serious, can cause something called scarlet fever and scarlet syndrome. Now, pharyngitis is going to be important with respect to Streptococcus pyogenes. And again, this is a group A strep. They have what's called an M protein. This is going to help them adhere as well as prevent neutrophils in our immune system from eating them. So they have an anti-phagocytic property. They're also going to have a pyrogenic toxin. This is going to lead to potentially a toxic shock syndrome and scarlet fever. They have other hemolycins, streptolysin O and streptolysin S, and another enzyme called streptokinase. So all of these help them to disseminate, invade our system, and get through into our blood. So scarlet fever is going to have a very distinct rash. The rash is going to appear red and it's going to be raised. It's usually in kids under 18 years of age, and it's going to be on the chest and abdomen. It also can spread to the entire body, and it lasts about 2 to 5 days. You're also going to have just a very typical high fever, a sore throat. Your lymph nodes in the neck can be swollen, lymph nodes, endopathy, and you're just going to have a typical flu-like symptoms. Now, Corynebacterium diphtheriae is going to cause another upper respiratory tract infection, and it has a toxin. So there is a vaccine, the DTP vaccine, diphtheria, tetanus, and pertussis vaccine. So if you do take the vaccine, the infection is going to be very rare. This guy can be transmitted by aerosols. It can also form fomites. These are basically dried bacteria that land on a surface. And you touch that surface with your hands, and then you bring your hands to your face, and then you can inhale the fomites, and you can get infected that way as well. Diphtheria can also lead to disseminated diseases, including multiple organs, and acute myocarditis can be caused by diphtheria. So Corynebacterium diphtheria is a gram-positive bacillus, and it doesn't really like to invade too much. It just kind of hangs out in your throat primarily. It has an exotoxin, and it's going to inhibit protein synthesis. And so every cell in your body, except for red blood cells, need protein synthesis. And so this can be a very toxic, it's a very toxic endotoxin, can affect many different organs, even if the bacteria stays localized. So diphtheria is also going to have a pseudomembrane, and this is going to be where the bacteria is colonizing. So you're going to get a lot of your immune system, death of cells that are being infected by the bacterium. The incubation is very short, 2 to 4 days, and you're going to have a pharyngitis similar to like a group A type of strep. Same similar features, flu-like symptoms, fever, sores, throat, malaise. The pseudomembrane is also going to be, it can extend into the larynx and the trachea, and you can potentially have suffocation associated with that pseudomembrane. Most are going to resolve this spontaneously. Again, if you have the vaccine, it's going to help you have minimal symptoms. Complicated cases can result in suffocation due to obstruction of that trachea. And then you also can have systemic infections, although very rare. Diphtheria is not one that actively disseminates, but it can cause a myocarditis. Now, treatments, you're going to have to neutralize the toxin because most of the symptoms of diphtheria are caused by that toxin that prevents protein synthesis. And so there can be antitoxin antibodies that will neutralize the free toxin. So this is a passive immune strategy. Also, Corynebacterium is sensitive to antibiotics. It doesn't have antibiotic resistance, so that can also help to eliminate the bacterium and prevent further production of toxins. All right, so one of the important things about the upper airways is they get infected quite commonly with our viruses. So 2 very common viruses of the upper respiratory tract are rhinovirus and parainfluenza virus. So one of the questions always is, how do I know if I have a cold or if I have the flu? So one thing to keep in mind with a cold, you start feeling just a little irritated, and then you have, your cough develops, and then maybe you start sneezing over a few days, and that would be kind of a cold. A flu would be you're fine, you're cooking dinner, and all of a sudden at 8 p.m. that night, you just feel like you cannot move, you're tired, you're exhausted, you're feverish. So flu will have very abrupt symptom onset. Your flu will also have a fever, usually. Colds rarely have fevers. Your aches and pains, so flu-like symptoms are fever, aches and pains, chills, fatigue. Those are all flu-like symptoms. So all of these here are very usual. And you can see on the other side for colds, those are all very uncommon. Sneezing is going to be common in colds. Chest discomfort, coughing is going to be common between both of those. And then your stuffy nose, sore throat, and are going to be more cold symptoms, whereas headaches are going to be more with flu-like symptoms. And so, again, one of the big key takeaways, though, is your symptoms are typically mild in cold and gradual, so they don't come all at once. Whereas with flu, they're really abrupt, and they're typically a bit more aggressive with respect to the symptoms. Now, with our cold viruses, one is called a rhinovirus. This isn't the only cold virus. Adenoviruses are also cold virus. And so rhinoviruses, the reason why you can have colds every year is because there are hundreds of serotypes of rhinoviruses. So the rhinovirus you had the prior year might not be the rhinovirus you get affected with this year. Not many of them have been characterized. Some are in other groups. Picornaviruses, for example, is a type of cold virus. They are going to have an optimal growth condition in your upper airway. So our upper airways are typically cooler than the rest of our body. The typical body temperature is 37 degrees. And so you can see that our upper airways are a little bit colder, and so these viruses like to grow in these cooler environments, and they do well in those cooler environments. The rhinoviruses or colds are going to incubate for a very short period of time. Symptoms are going to last anywhere from 3 to 7 days, so very short, mild symptoms, and typically you don't treat the virus, you actually treat the symptoms. So you get over-the-counter types of medications to help alleviate coughing, sneezing, those type of things. Now, our parainfluenza virus is going to be another single-stranded RNA virus. This is called a parainfluenza. It is similar to influenza in that it does have hemagglutinin and neuraminidase, similar to our traditional influenza viruses. However, this is a very, very different virus. Parainfluenza virus is in a Paramyxoviridae group. This is the same group as measles. Our traditional influenza virus is an orthomyxovirus, so they're very different viruses. These guys are going to have a pathology similar to influenza, except for they do not change. So, for example, parainfluenza viruses are going to be serious in our infants and our children, but once these infants and children have parainfluenza virus, they are going to have memory for the rest of their life, and they're not going to get infected with it or serious illnesses with parainfluenza virus as they get older. You're going to have initially an upper respiratory tract infection that can lead to involvement of the lower respiratory tract after a few days. And then usually you're going to have about a 10-day illness up to 21 days, and there is no treatment. It's just going to all be supportive care. So a few of the important ones are type 1 parainfluenza virus that causes acute croup. So that's that coughing noise that infants make that is potentially very harmful for children. They cough so much that they can't breathe. These are going to cause, again, severe upper respiratory illnesses, and usually this is seasonal, so it occurs typically in fall. Type 3 is going to cause the lower respiratory infections in infants. This is going to be more bronchitis and pneumonia. And this is different than type 1 because it has no seasonality to it. However, it's very contagious. It's very common. So by about the first year of life, most children have been exposed to this virus and have their protection.